My name is Kathy Neal. I have an associate's degree in nursing, and I'm a certified foot care nurse. I'm 55 years old, and I have a husband and a grown daughter. I currently have 2 dogs, 2 cats, but I share my home with every stray that comes along until I can find them a home. I started my career as a licensed vocational nurse in 1989, and I got my associate's degree in 2000. I've worked in a variety of healthcare settings, from drug and alcohol rehab to physical rehab, telemetry, med-surg, and finally wound care. As a small child, I dreamed of being a teacher, and I used to line the neighborhood kids up to play school with them. Although nursing wasn't my first dream, it has allowed me to incorporate both when I teach my patients to obtain their optimal wellness and when I mentor other nurses along the way. Humanity and Society Construct. The Care of Communities class taught me how to practice safe and effective patient-centered holistic care to a variety of patients in multiple settings from a global perspective with 100% mastery. We were asked to do a community teaching project for an at-risk population in a disaster. I chose dialysis patients to teach and research their needs. Most people don't realize all the things a community of healthy people need, and when you add people with special needs to the mix, deviations from the norm could result in injury or even death. My plan and video taught dialysis patients what they would need to assemble and keep on hand at all times prior to any disaster, as well as items they would need during and after, and how to plan ahead to receive their dialysis treatments. This is an especially useful tool in this area with the frequent evacuations that we have had in recent years. I feel confident that my video could be passed out to real patients and would be effective in meeting their needs. In the lifespan health continuum construct, I learned to support patients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity, first by learning to do a complete head-to-toe assessment to know what's normal or abnormal in my comprehensive holistic health assessment class, and then in the nursing theory and online education class. We were given online discussions with our peers and focused insight questions where we were given different patient scenarios using 4 major nursing theories to address a variety of clients and their physiological as well as their psychological needs. The Community-Based Service Learning Activity, or CBSL, in the Care of Patients with Compromised Multiple Health States class, where we picked a client we had cared for, discussed their disease process, and then found 3 community resources to help them, helped me to understand what the patient's needs were beyond just caring for the problem they came into the clinic for. It made me realize that if you don't fix what caused the problem to begin with, you're only putting a Band-Aid on the problem and covering it up. Community resources, for instance, may help them get food so they will have the protein necessary for wound healing. I learned to evaluate patient-centered care for patients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health in the Care of Patients with Compromised Multiple Health States class. We were asked to select a book from a list of patient memoirs and use one of the major nursing theories to use interventions for the problems the patient was having. I chose Brain Wreck, A Patient's Unrelenting Journey to Save Her Mind and Restore Her Spirit by Becky Dennis. It was very unfortunate that this patient was all alone in her quest for answers. I researched what caused her problem, her symptoms, testing, and treatments for her problem. I picked Erickson's modeling and role modeling theory to guide my care for her because it allows the care to be customized to the patient's needs. This theory allows the nurse to see the world through the patient's eyes and to tailor the goals to be what the patient wants. I felt that this construct was mastered at 100%. Evidence-based practice and clinical reasoning construct. I synthesize clinical judgment in nursing practice using critical thinking skills, the nursing process, research, and evidence-based practice in my nursing inquiry and evidence-based practice class. I researched quantitative and qualitative studies and wrote essays on both. I also critiqued a journal article on a quantitative study about depressive symptoms and compromised parenting in low-income mothers of infants and toddlers. Looking at this study taught me to dig deeper than face value, not just judge and decide that the mother is a bad parent, but to use the evidence to find out why she has poor parenting skills, and then using current practice guidelines to find the best way to help her be a better mother. If she is not given the coping skills to succeed, her children are at greater risk for delayed learning. The evidence teaches us the correlation and the strategies to intervene. My clinical judgment and critical thinking skills began evolving from the first assignment on ethics. Ethical dilemmas I was asked to respond to, along with responses from classmates, caused me to have many a paradigm shift on subjects that I thought I had firmly cemented opinions on. Through this class, I gained insight on how studies are performed and how proving what is effective becomes the basis for evidence-based practice. I feel I could pick up any nursing journal research article and fully understand what I'm reading. This class taught me 100% of the skills I need to continue to further my nursing knowledge and provide my patients with the most up-to-date care. Patient client-centered care construct. Learning to employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients and members of the interprofessional and intraprofessional healthcare team was met in the nursing theory and online education class. We were asked to write a philosophy paper that compared our own philosophy with the current philosophy of nursing. I believe the theories we studied, such as Watson's caring theory, Erickson's modeling and role modeling, Newman's systems theory, and Roy's adaptation model, all have merit, but I feel more closely aligned to Watson's and Erickson's. Watson uses caring to meet human needs and promote health, and Erickson's theory allows the nurse to see things from the patient's perspective in order to meet the health needs the patient wants met. These two theories seem to be more patient-centered to me. If we drag a patient back to a healthy state, kicking and screaming to meet our goals for them, we have not accomplished anything. And my perception is that I met 100% of my goal to learn this construct. Professional roles construct. I learned to differentiate multiple role dimensions and practice within ethical, legal, and regulatory parameters when caring for patients as a member of the interprofessional and intraprofessional healthcare team. In the Nursing Theories and Online Education class, I wrote an essay about the Differential Essential Competencies, or DEC. This paper outlined the nursing roles, including the differences in the different levels from LVN to ADN to BSN, with each having more responsibility than the last, and the BSN having a more supervisory role. Each state has a Nurse Practice Act that defines the standard of care and the nurse's responsibilities. The DEC lists 4 nursing roles: member of the profession, provider of patient-centered care, patient safety advocate, and member of the healthcare team. And there are 25 core competencies that use current evidence-based practice to prepare nursing students. We were given a scenario where a patient had a problem and asked to delineate the different roles that the levels of nurses would perform in that instance. This exercise helped me learn with examples what my role as a baccalaureate nurse will be. I can now demonstrate professional integrity, effective communication, active inquiry, and service to the community, because in the leadership and management in the healthcare system class, I volunteered at a soup kitchen and then gave a PowerPoint presentation about the experience. I learned how to get involved, and I saw firsthand what a difference each of us could make in a less fortunate person's life. The people standing in line for a free meal were very appreciative of the food and the kind, caring attitude from the people who were passing it out. This was my favorite project of all the classes projects, and I think I learned this construct at 100%. Capstone and 5-year plan. When I finish my baccalaureate degree, I plan to take 1-year break from college courses. I will continue working in wound care, where I can mentor nursing students and teach patients to reach and maintain their maximum state of wellness. During this college break, I will also obtain my WOCN certification. When I return to school, I will pursue my master's in education in an online program so I can continue working. Once I obtain my master's degree, I will apply for jobs at high schools, colleges, and wound care teaching programs, and accept whichever door opens first. Sandra Fowler, RN and family nurse practitioner, and Dr. Nancy McAfee have been my mentors, and the nurses that I most wanted to emulate since LVN school. The first day of class, Miss Fowler walked back and forth in front of the class with her freshly pressed clothes and her shoulders back and said, "We're going to teach you to walk nursing, talk nursing, and breathe nursing." Initially, I thought I had joined the Army. The first time I saw Dr. McAfee, she just kind of floated into the room. Her angel wings just wouldn't let her touch the ground. I knew I wanted to be just like the two of them, and I hope someday someone will feel that way about me. My references came from the Texas Board of Nursing website and the Wound Ostomy Continence Nurses Society website.